It's Patrick Hutzel from intensivcarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from one of our readers. And the question last week was part 1 of my husband had open heart surgery with complications. He's not waking up. He needs 100% of oxygen. And now he's bleeding from the stomach. I'm so scared. Help. And that was part 1 last week. You can also check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question and the next question from our client, Katie. And they are excerpts from email counseling and consulting sessions with me. And the question this week is, my husband had open heart surgery with complications. He's not waking up. He needs 100% of oxygen and now he's bleeding from the stomach. I'm so scared. Help. And today is part 2. This is another great series of questions where I was able to basically handhold a very anxious and distressed client through a very stressful and complex situation. So Katie writes, "Hi Patrick, thank you so much for your quick response. My husband had aortic valve surgery on Thursday, as you know, and today, due to this hole in his heart, which is also called a VSD or a ventricular septal defect, he had a second surgery to repair the hole. I didn't know he had the hole until a procedure showed it, and my husband didn't tell them about it prior to the surgery. The doctors determined the hole was preventing the blood from going to the lungs to give the lungs oxygen, but instead were just going from one chamber of the heart to the other, and therefore he had to be ventilated on 100% of oxygen on the ventilator since Thursday. Yes, also as you suggested, they did give him nitric oxide, also known as NO, with the ventilator before the VSD surgery. Since the surgery, which was completed by 4:30 this afternoon, and it's now about 9:30 as I'm writing this, there hasn't been any change, still on 100% on the ventilator, though we are all hoping this second type of surgery would provide more oxygen to his lungs. Now what? My husband is totally sedated again. Is there anything you can suggest? It means so much to get your outside thoughts and opinions. How can I thank you for the hope you are giving us? I'm so grateful for your prompt and detailed explanations. I'm so very afraid and I'm trying to be strong and staying positive. He's also bleeding what looks to be old blood from his stomach. They could give no explanation for that. His blood count is low but not enough to give him blood. Any ideas about that? The surgery itself seems not to be causing any bleeding problems. I'm very sorry to be asking so many questions. I have read about intra-abdominal hemorrhage and there is a correlation with open heart surgery where the spleen and liver can bleed. They say it is old blood, darker in color. I'm so upset and it's not good. I'm so scared. Please help me respond to this, to his caregivers. They just say it's common. I don't think so. Please respond. Many thanks, from Katie." So, here is my response. Hi Katie, there is definitely a correlation between any type of surgery as well as intensive care admissions in general and stomach bleeding, also called GI bleed or gastrointestinal bleed, but I wouldn't say it's common. It's something to be mindful of and it's something that needs to be prevented in the first place. It's often a stress response. The stress of being critically ill causes the stomach to produce more acid. This may have also already happened leading up to surgery with your husband feeling uneasy about going for surgery and into intensive care. More acid in the stomach can cause bleeding because the pH is trending more towards the acidosis side, and it basically erodes the stomach cells, causing ulcers and a bleed. This has been well documented over the years in intensive care. The risk for a stomach ulcer and subsequent bleeding in intensive care patients is huge because of the reasons I mentioned. Normally, in order to prevent bleeding to occur, patients in an induced coma and on a ventilator should be receiving nasogastric tube feeding as early as possible to maintain a healthy and physiological stomach and pH environment. Other preventative measures include giving pantoprazole or esomeprazole or ranitidine. Those drugs all reduce the acid production in the stomach and are almost always standard intensive care treatment, as stomach ulcers are a well-known and well-documented complication of ICU admissions with often dramatic consequences. That's why it's so important to try and prevent those ulcers and gastrointestinal bleeds in the first place. Common treatment for gastrointestinal bleed includes giving units of donor blood, fresh frozen plasma, and/or platelets. Also, if stomach or GI bleeding is ongoing, a pantoprazole infusion should be commenced as well as nasogastric feeding should be continued as early as possible to again maintain a healthy, normal, and physiological stomach flora and pH. Other medical treatment includes giving, again, pantoprazole intravenously, often as an infusion. Furthermore, starting to feed your husband through a nasogastric feeding tube will remove the risk of bleeding as well, as long as he can tolerate it. In some instances, a gastroscopy, which is basically putting a video camera in the stomach, is also necessary in order to find the exact source of bleeding. The next issues around bleeding is simply that during the AVR replacement as well as the VSD closure, your husband would have been on a bypass machine, and during that time he would have been given some heparin, which is a blood-thinning medicine. This increases the risk of bleeding significantly. However, a GI or stomach bleed is often a result of a stress response and results in acid production in the stomach and then the bleed. Now, as far as your husband's induced coma is concerned, they will need to make sure that he's stable first and foremost before they will take him out of the induced coma. The complications that I mentioned in my previous email, like pulmonary hypertension, low blood pressure, will almost likely persist for now, and the pulmonary hypertension in particular may stabilize once the nitric oxide can be weaned down, as the pulmonary hypertension will be reduced. Again, pulmonary hypertension is high pressures in the blood vessels that supply the lungs with oxygen. Those blood vessels are connecting the right side and the left side of the heart. Furthermore, your husband is most likely still having a critically low blood pressure as a side effect of the bleeding, as well as a side effect of being sedated and in the induced coma. Because of this critically low blood pressure, he will need life support and medications called vasopressors or inotropes. Vasopressors or inotropes are intravenous drugs to increase blood pressure to a level so that life is sustainable. Common drugs being used for vasopressors or inotropes are adrenaline, also known as epinephrine, also noradrenaline, or also known as norepinephrine. Also, for patients in heart failure, dobutamine, dopamine, or milrinone are being given to increase the cardiac function of the heart. Overall, your husband remains in a critical condition, especially with having been through 2 major open heart surgeries within 48 hours. On top of that, he's dealing with the bleeding from the stomach. Therefore, he most likely will need to stay in the induced coma until he is more stable and until they are certain that there is no more bleeding. They will also need to wean down the oxygen to less than 50% on the ventilator. The nitric oxide, as well as the vasopressors or inotropes, before they can take your husband out of the induced coma. Please also keep in mind that your husband would have had even more sedatives and painkillers in the last 48 hours than many other patients in intensive care because of the surgeries. Therefore, it might take a while until he will be awake. I know how frightening this experience must be for you and for your family, Katie, but being patient is your biggest asset in all of this. Wait another 24 hours, keep close communication with the doctors, the nurses, and myself, and I can keep hand-holding you through this challenge. I hope that helps, Katie, and I'll talk to you in your next email. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. Well, you get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.